Okay, take it away.
We went to the CASA and like Claudia, Kim, Marie. Okay, so what need is your program addressing? What our program was about is manpower shortage makes it impossible for judges to get a clear picture of what is happening with the attendance of the court. So what that means is like there's a lot of children that are in the system, and when the judges make decisions on the child's life, they thought it wasn't very right to do that without knowing this. So that's why they have this advocate, and the advocate gets to know the person and speak for them during their court cases and stuff. So then the judge can make a better decision on the child. What data demonstrates the existence of the problem? Well, as we all know, there's many children who are in the system. So on any given day, the Orange County, there are nearly 3,000 children who have been removed from their homes, their parents' care, and placed in and out of the home care due to the abuse and neglect. More than 87% of children referred to CASA have been in the system for more than 6 months and some much more long. Has the problem changed over time? How has it changed? How do you know this? So when we were interviewing the lady, she said that the problem hasn't changed, so there's still many kids who are in the system. The only thing that has changed is the law. And with the law, it's the AB 12. And with the law, how CASA was that because before they were only able to stay in the program till they were 18, this allowed them to stay up till they were 21. So that was very helpful for the children. What methods are used to identify and locate people in need of these systems? So it was interesting to find out that they're all in the system, so they're all court referral. So they don't go out looking for these kids. They're given to them.
And process, what data is collected on personnel when they're hired. They look at education, although having a degree is not a requirement to work there. Experience with abuse and drugs, just dealing with those populations. But they even hire people who had previous history of abuse, just as long as they were clean for at least 5 years. There's an intense record clearing process with the FBI, the Department of Justice, Child Abuse Central Index, the DMV, car insurance, and then they have a full authorization. So say any time that they're out there and say they get a DUI, automatically CASA is notified so that they can kind of take control from there. And all of that's done by the office manager. So what evidence do they have in staff skills and qualifications? Education if they have it. They also have to provide 3 personal references. And then of course they can look at previous work history if they have it. As far as what's collected on volunteers, it's exactly the same information. The only difference is the data is collected and tracked through a monitoring system by the training coordinator. What training do staff get? The first couple months they have job shadowing. So they're following somebody to court, to social services, and to home visits with the kids. And this is assessed kind of just by personal competence, and as the program manager might see, that they're getting their job done. Also monthly they have workshops where the employees get together and they might learn, about the new law like AB 12 and how to implement it, how it's going to affect CASA and such. As far as volunteers, they have 40 hours of training prior to becoming a CASA. And that could be workshops held by judges, social workers, other CASA employees, maybe about the laws, child abuse. It could be as simple as learning how to answer a hard question your CASA might ask you, like, have you ever had sex or something? Because the kids do ask difficult questions like that. Also, they have 12 hours of training that they have to do after they become a CASA, and that's all assessed by self-surveys. How do you monitor the staff? The program manager meets with employees once a month to go over all of their caseload, and at that time they can talk about their needs or what's going right. And there's also a database that provides information on each individual child. It keeps track of their education, their health, court hearings, social work reports, and CASA logs that are done monthly. How do you know that the appropriate clients are receiving services? They have that database, so it's a constant monitoring process. And also, a lot of times, kids in the foster care system, they're not just like in a group home. They might be placed with families, so it might not be that bad for them. They might have somewhat of a normal life. And at that point, you may get assigned a CASA, and the CASA and the child can say, oh, you know what, things are really going good for this kid, so I think, I'd be better going to another case. What data indicates that the activities the agency is purportedly doing are actually being conducted by your staff and are being done at the level and duration specified in your proposal or annual report. The case supervisors, once again, are tracked by the program manager in the database, and then the training coordinator gathers statistics on all of the volunteers, so maybe who calls, is interested, who attends an orientation, who completes the program, the 40 hours, and so on.
So, what client outcomes do you measure and how often? They measure it with several different levels. They measure it through their school. They look at the change of placement, behaviors, goals, medical or mental health, and it's through this database that they pull this information on. And so they take about these measures every 6 months to see if there is a change or not. What methods? Methods they use are observational, and they're basically like self-report, self-assessment. So they have every year, they have the CASA take a survey, or the client take a survey. They put down, I like my CASA, or they put in the questions about their CASA, and then they take it, and then they review the information to see what they need to change or not for the child, as well as the CASA themselves go through this process as well, taking surveys. And they also get information from the social workers and the courts. What standards do you consider a success? From the person we interviewed, she says they believe, they don't really have a set standard of what a statistical success is if they have no concrete data other than observations. So they compare it to the marked improvement and what they believe they compare the marked improvements between if they go up in mental health, they're no longer seeing the child needs to go to therapist as often, they're not seeing a fluctuation in placement, or their grades go up. They find that as a success. What sort of data is used to evaluate the program's overall effectiveness? This is where they admit they can't do it well because they don't have a way to accumulate this data. And they're also unsure of what effect the actual CASA has when compared to the large scheme of everything, so the social worker, the court, the family members. So they depend on the volunteers to tell them what is overall, like the CASA, what is overall the program being effective for the child. Is the knowledge and understanding gained through the program? Absolutely. Sometimes the CASA is the only one to actually help the child understand what's going on in their situation, and they're the mediator to help explain why they're going to court, why they can't be with their mom and dad, and just everyday life situations as well. How is it measured? As I said before, they attempt to measure it through a yearly survey, and they ask the child to write down their thoughts and feelings about their CASA. Is there a change in beliefs or behaviors? She said there is because they can actually measure the change in grades, the change in their medical, or change in attendance, and with how they're doing within school or life. How is it measured? We were told it was hard to measure, so again, it's just a very hard way to measure these. So one question that stood out in the questionnaire was, what do you think of your CASA? And so that's one way they try to figure out if it's actually being effective, if the child is actually being changed by the child's own opinion.
Okay. So what methods do you use to determine whether your program operates cost effectively compared to other programs? Well, there's really no other programs compared to it, similar to it at all. Plus, CASA is it's a court referred only. So the only compared is Big Brothers and Sisters, but because of budget constraints, they focus now on group activities only, and CASA is one-on-one. There's 650 volunteers, and right now CASA has 650 children, so there's one volunteer per child. They volunteer 12 hours a month, which is about 50 to 80,000 hours a year, plus they have 30 paid employees. Then they have a Board of Finance committee that handles their grants, which are about $50,000 a year, and they run basically off fundraising of $2.6 million. What are the benefits of this program to stakeholders? Well, the volunteer hours saves everybody money, obviously, and it's excellent collaboration for the social worker, the probation, and the courts. It's a second set of eyes and ears for them. It leads to safer communities, less crime, less homelessness for these teens, and younger than teens. And it leads to a positive outlook for the future leaders of America. And then also the excellent communication through the database. So what services offered by this program are done by volunteers, and how do you evaluate it? Well, all the services provided by CASA are done by the volunteers. Everything. They do the monitoring, they do the mentoring, they do the advocating, they do court hearings, they do IPEs, which are individual education plans, they do the TDMs, which are team decision-making meetings. And the only way to really look at it is the surveys. They have end-of-activity surveys, and they have end-of-year surveys. Okay, how do you overall effectiveness of the program? They have cutbacks on their paid staff. They have positions that they haven't filled for a couple years, and the number of volunteers. Are any proportions of your service underutilized? Well, they don't have any services that they provide. You go to your kids and pick them up at a park and do what you want to do. And there's always a wait list for the kids to get a CASA. So why is this a central location, and there is no real hub for anybody to meet? So the only thing is that it's centrally located for Orange County for the volunteers, and it's 4 to 5 miles from the courthouse and social services. Okay, what methods do you determine effectiveness on your specific program? There's 5 areas: mental health, change in behavior, change in placement, education performance, motivation goals, and future. The activities, again, are just the surveys, and the communications from other agencies, courts, social services, and all the other things that the children are involved in. So the weaknesses of the agencies, the evaluation methods, and the procedures.
For the meetings, it was, we thought that one of the weaknesses was that they don't open it to the public, because they just considered court cases and children who were in the future.
First, for the process, we thought there's no really support for the CASAs themselves, for volunteers. They raise all this money, but they don't really, the volunteers have to pay for all the activities they do with their child. So we thought that giving them a little financial support would be good.
Some more fundraising and stuff. On the outcomes, this I think was their biggest weakness, because there is no, we looked at the data, they give us the surveys, they give us some of the stuff, and even though they are doing surveys, when I asked them, like, how can you do, like, a simple, like, questionnaire from 1 to 10 and do it, like, where you can actually take data of, like, strongly agree, disagree, they said they couldn't do that, and they kind of, like, threw out the idea when I, like, asked about it, because that was one of my main things. So they really just depend on observation, which isn't really effective for, like, sure, they get the medical records, but there is no way that they can track after the CASA leaves, after the child leaves the program, no way to check this stuff after. They just depend on stories.
So the effectiveness, I forgot to mention, they have a small kitchen that it's not utilized at all. When a CASA takes their child there, they really enjoy it. They hope to one day expand it to grow that kitchen so that it's there for cooking classes. And the lack of distribution of funds. They fundraised $2.65 million, and there's 30 paid employees, and CASA does not, the agency does not sponsor anything. All their activities are donated. So where's all this money? That's the question that we had. So.
But another reason is for the outcome was that they really have no proof of saying that CASA has helped this child. They have no data to use that.
Strengths of the agency, evaluation methods, and
For the need
procedures.
was, they had a one-on-one contact, which is really good because, the youth get to have one-on-one conversations and connect with that one person, so that's really good.
You're over by 1 minute already, so wrap it up.
There's little staff turnover. In the past 5 years, there's only 2 new employees. The outcomes is the fact that the children's behaviors are impacted by either medical, academic, or social. So they actually can see like the actual outcomes of the child being affected by the CASA.
And the efficiency is just to keep the attraction going for keeping up with the volunteers, so each one of the children are allowed to have one CASA.
Give them a hand. I especially want to give you to tell